closer to the athletes, coaches, families, and fans of Cincinnati sports. It's On the Sidelines with Q102's Mollie Watson and Lindsay Patterson. Presented by OrthoCincy, the orthopedic authority.
Welcome to On the Sidelines. Today, our special guest is Dr. Brandon Kohrs, an orthopedic surgeon and sports medicine specialist with OrthoCincy Orthopaedics and Sports Medicine. We understand you're also a former college athlete, so we'll touch on that a little bit. And you can really offer a very unique perspective when it comes to specific injuries. So thank you so much for joining us today. We really appreciate it.
Thank you for having me. Happy to be here.
Yes. So I want to start with your focus at OrthoCincy, upper extremity. Can you explain what that means?
I primarily see shoulder and elbows, primarily shoulder type pathology. So a lot of rotator cuff injuries, arthritis of the shoulder, and then elbow injuries as well, which can be from overuse. We do see a lot of, probably the most common non-operative pathology that we see in the elbow is actually something called tennis elbow, which actually is quite rare for individuals who play tennis, more in the, people who type a lot. So see a lot of overuse type injuries, a lot of arthritis type injuries. And then, one of the big ones is rotator cuff throughout the years, be it, in your 40s and your 50s from a traumatic injury to something more wear and tear as you age, 60s, 70s, which can actually even turn into something called rotator cuff tear arthropathy, which is kind of an end stage, rotator cuff tear that has now progressed to arthritis. And in that patient population, typically individuals in their 60s, 70s, and older, you actually consider shoulder replacement. So we do a lot of rotator cuff repairs, a lot of shoulder replacements, and then a lot of fixation of fractures that people get from, falling and injuring themselves out in the community.
Okay, so you did play collegiate football. Tell us a little bit more about that. Did you ever face any of these types of injuries? Where did you play? What position? Just brag on yourself a little bit.
So I went to Thomas More College, now Thomas More University.
More.
Yeah, over in Northern Kentucky. Great place. Shout out to my old coach there, Coach Hilvert, who's now coaching up north, and then the current coach, Coach Norwell, who's doing a great job there. So
did you know? Sorry to cut you off. Did you know Trevor Stellman?
I did.
Yeah,
yep,
good.
Yeah.
Our families are good friends, so we've actually had him on the podcast before too.
Yeah.
Great guy.
He was our quarterback.
When you were
junior senior year.
Oh, okay, okay,
yeah.
Great.
Yeah, so we were the same year there. But yeah, so as I was going to say, if you are looking for something to do on a Saturday, always feel free to come out to Crestview Hills. It's a great experience, great atmosphere.
It is, yeah.
And a lot of fun there. So I played there 4 years, outside linebacker, was on a good team. So, good personal accolades come from people who are on good teams. So, I had a couple of all-conference awards, which was nice. And I was team captain my senior year, so all those things are always nice to help you, in the future as you move forward from a leadership standpoint. Had some good success there. We won a couple of conference championships, and it was actually really good from a life standpoint, just a life balance from balancing school and trying to excel in that, knowing that I wanted to go to medical school. And also, trying to excel at football and, balancing kind of all aspects of your life and proving that, there's enough time in your day as long as you're focused and structured with what you do. So, and then did have a few injuries along the way, actually, mostly shoulders, which is probably why I gravitated to the shoulders.
Yeah.
A couple of AC separations, probably some labral tearing. You self-diagnose without an MRI, and I'm pretty sure I've got a pretty good labral tear in my shoulder that it clicks when I move it certain ways, and so I just try not to do that.
Just what did you say earlier? Play through the pain, or what were we talking about? Just continue on. Lindsay,
what I say, not what I do, right?
Yeah.
Yeah.
It's the unofficial end of summer, even though we're recording this and I feel like it's 90 degrees outside. What have you noticed when it comes to some of those summer injuries that we just came from?
A lot of the injuries we saw in summer were overuse. I mean, people out having a good time, enjoying themselves, and you stumble, you fall, you trip, or you're doing different types of recreational activities outside, different sporting events, and you injure yourself. And a lot of that's brought about by lack of conditioning, lack of proper training, lack of proper warm-up, and a really big proponent of exercise, working out. It has tremendous long-term benefits, even from a health longevity standpoint, actually even help you live longer and live longer healthier. And so that's something I would encourage all of our patients to do is the exercise regularly. And if you're ever unsure of what to do and you have some issues, some wear and tear type things, you can always come see us at OrthoCincy, and we can help to point you in the right direction as far as doing things to decrease your chances of getting hurt.
Are there certain activities that seem to be bigger than others when it comes to the injuries?
It's all going to be activities that promote sudden acceleration. So from a sporting event standpoint, for our weekend warrior type individuals, like pickleball is a big one, where it's low stress, and all of a sudden you have this high stress, high sudden transition, increase in power type activities, and that's when you tend to see these injuries occur, these more traumatic type injuries. And then falls, walking the dog is actually quite a much too common cause of injury. Actually, we see a lot of fractures from people walking dogs on a leash. Dog pulls, dog goes left, dog goes right. You're in the house and the dog sneaks up behind you, and you trip over the dog. So being careful walking your dog, something else too to think about that most people don't.
Yeah, I sprained my ankle last fall just on a curb. Just walking in, heels, and just slipped off the curb and rolled my ankle and ended up coming to OrthoCincy to get treated for it. But do you see this, I'm 34 years old. Are these type of injuries, is it everybody? Is it young, or is it, where is it? What are you usually seeing?
Injuries tend to increase as you age.
For sure.
You tend to be less elastic, less flexibility. And those are the things that you need to try to keep as you age, is that flexibility. So proper stretching, as we talked about, exercise, proper nutrition, diets that promote proper protein. And so you're keeping your muscles as strong as you can so that you're better able to tolerate those sudden changes in movement where you twist your ankle on a curb, but you have a strong core, so you're able to support yourself, and it's just an ankle sprain. It's not, I completely fell and I broke my hip. Well, that's not good.
That didn't happen to me, thank goodness.
Thank goodness.
That could have been really bad.
Yeah.
One of the things, and again, I'm sorry, I have to connect this to football and the Cincinnati Bengals, because my next question is playing through the pain. One of the things last year, and I know it's not related to what we're chatting about, but it was a calf injury to Joe Burrow, and he had talked about going into the season of not playing through the pain because that could make it even worse. Even those tough guys are like, I'm going to be fine, no worries. What are some of the bad things, the negative parts of playing through the pain and not just going and seeing someone right away?
Delaying the amount of time it takes to get better would be the number one thing. And then number two is obviously having things get worse. So it's just a mild strain or sprain. And we're talking about glory days. I had a little quad strain, and it was just mild, irritating, and you keep pushing through it. And then, you're working out with some younger guys and you want to show them what you can do. And so you, squat a bunch of weight, and then you go out and you run sprints. And the next thing you know, you're out for the first, 3 weeks of, your practice in camp because you didn't let things heal and you didn't do the appropriate things early on to decrease the chances and decrease the risk of having those major injuries in the future.
When someone gets hurt and complains about the pain, you suggest they go to the ER. But they're like, well, let's just see if it gets better, because the ER is a pain, and this doesn't feel urgent enough to be an emergency. Well, OrthoCincy Orthopaedics and Sports Medicine is the alternative to the ER. You can walk in, get immediate attention, and maybe spend less money. So for fractures, sprains, strains, and injuries from sports or work, skip the ER and visit one of the many OrthoCincy locations in our area. Learn more at orthocincy.com.
You want to talk about the Bengals now?
Yes, we can move on to the Bengals just to make a little connection to what we were chatting about here. But no, I think all of that is extremely important, because I think a lot of people, they just think, I can do it, I'm going to be totally fine. But go get it checked out. If you're feeling any pain, go get it checked out and feel better. While we have you here, our attention to the Cincinnati Bengals, I want to talk about quarterback Joe Burrow really quickly when it comes to his wrist injury and kind of what he is dealing with. He even talked to the media yesterday, because I think a lot of people, they pointed at it. They said, oh, he's moving his wrist around. What's going on with him? And he said, hey, I'm just trying to move my joints around, because if I don't move it, I'll lose it. What do you notice when you see things like that out of an athlete or anybody who is kind of doing those motions on the sideline?
Yeah, I didn't really think it was that weird how he picked up that water bottle, number one.
Oh yeah, that was a
goodness.
trending story, and it was a whole
I thought
thing.
that was, it was like down there and he picked it up, and I don't know. I picked up a water bottle, I think, like that before too. And even the wrist movement, you had surgery, right? He still had surgery less than a year ago. And so, you're going to always, anything you've ever injured, right? Everything's always a little different, and it doesn't mean it's hurt. It just means that, you've gotten in the habit now, what he probably has for the last couple of months, where, now he feels like he's been moving his wrist and he's been doing things like you saw in the videos where he's moving his wrist and he's going in circles, and that might have been part of his training regimen for a couple of months. And now mentally, that's just what he does when he's not thinking about stuff. He's moving his wrist around, and I think he looked fine. I think he threw the ball fine. I think it's still going to take him a while to get his game stamina back up. And, a lot of, they talk about how he didn't have a lot of throws downfield. Well, I think a lot of that was, you take what the defense gives you, and I think he's going to be okay.
You're making me feel so much
All right,
better.
Lindsay, breathe.
I just needed to hear that. I've been, nonstop for the last 48 hours. Is everything going to be okay? But I agree with you. Just everyone keep calm, take it easy. And I kind of want to go to his wide receiver, Tee Higgins, because he was someone who Joe was connecting with at training camp. And then all of a sudden, Tee wasn't amazing. He had a hamstring injury, something that Tee has dealt with his whole entire career, even going back to Clemson. He went from feeling amazing that he might go in the game in week 1 versus the Patriots to, they're going to take it easy on him on the rehab field yesterday. But right now, Tee Higgins hamstring, what are you expecting? What's that like? And is it going to be something that lingers all season?
It depends on how severe it is. Because a lot of these injuries, right, you can get back to where you're running around and it just kind of irritates you a little bit. And it all depends on the severity. If this is something that he's had before, this is something that he's dealt with before, then hamstrings, quad injuries, Achilles, all these types of injuries that people get, they can tend to sneak up on you from time to time again. Especially like baseball players with oblique injuries. You have one, and then the next thing you know, every couple of years you're having the same thing. Same thing with hamstrings, and I think I'd get an adductor strain every year during camp, just like always the same thing. And it's just those movements that you haven't done in a while. And you can train all you want, but until you're going full go and that adrenaline's pumping, you're not really challenging your body to its full extent. And so, maybe he's out there and he's doing that and he's like, that's a little uncomfortable. Why don't we shut it down a little bit and slowly build things back up so that he's playing healthy either this week or next week or hopefully not a few weeks from now, instead of something that lingers throughout the season and you have a 80% Tee Higgins instead of somebody who's out there at 95, 100%.
So are there any treatment options besides rest, or what are they doing with him right now?
I would anticipate rest, stretching. So you got to get the inflammation out, get the soreness out, anti-inflammatory medications, those different types of treatment modalities. Longer term, you look into the more like the PRP stem cell type treatments, could be a consideration to get him back out there faster. But I think it's probably just rest and stretching and letting those muscle fibers heal.
So with the weather changing, right now it's very hot. Everything's kind of loosey-goosey. Once the weather gets a little bit colder, how will that affect things with how he's feeling?
It can make you a little more stiff.
Okay.
On the other side of things, you stay away from the heat and you decrease your risk of cramping. Now you're more properly hydrated. It doesn't get later on in the game where all these muscles and everything are kind of giving up and getting tired. I think that there are benefits and detriments to the cold, but I think October, November football before it gets too cold is probably a sweet spot to get out there and play.
Okay. Is there anything else you'd like to add? Anything else with the Bengals that we should that Lindsay, you good over there? You feel okay?
Yeah, I think there is, just from a fan standpoint in football in general, right? Like if they beat the Chiefs, everybody's going to say they're going to the Super Bowl, whereas they lost this week, everybody thinks they're going to lose every game the rest of the season.
Mm-hmm.
And as you'll hear time and time again, it's hard to win games in the Professional Football League. And these guys are all the best of the best at what they do. And it's a very thin margin between winning and losing. And I don't think they played very well against the Patriots.
I agree.
Like, they played awful. They had tons of turnovers. Their red zone offense was not very good. And they were really good with not fumbling the ball last year. And it was uncharacteristic. And I think hopefully it's a fluke game. And, let's see what they do this week.
Thank
I
you.
feel so much better. I just
Lindsay
I
Lindsay
needed
can
this.
let out a nice sigh.
I
We
needed this
love.
interview. No, you were fantastic,
Yes.
and I think I think a lot of people they're learning. Hey, if you're feeling anything, you have any pain, go see a professional. Don't just act like you're a warrior and you can deal with it all on your own without seeking help. So all of that is extremely important, and people need to remember.
Yes, go see one of the incredible doctors at OrthoCincy. And we love having you guys in, especially during the season, whether it's Reds, Bengals, FC Cincinnati. You always explain everything so well and kind of, calm Lindsay down a little
Just a little bit.
because she gets very stressed. Thank you so much, Dr. Brandon Kohrs, for joining us on the sidelines. Remember, as we said, for sports, work, or everyday orthopedic injuries, OrthoCincy is the orthopedic authority. Learn more at orthocincy.com. We'll chat with you in a few days.